Hello and welcome to our next parent counseling training. Today we're going to be talking about reaching toileting goals with our kids. Again, I'm Stephen Emerson, the counselor here at Hawthorne.
And hi, Jim Moran, BCBA, and the senior teacher here at Hawthorne.
Yeah, and so today we're going to be talking about toileting concerns, goals, and how to work with our kids on, reaching those goals. Toileting support for students with autism. So, just generally what parents need to know, right? So there are lots of evidence-based approaches out there. I'm not going to be including them all on these particular slides. However, there is going to be an entire packet uploaded with the slides on the Hawthorne website. If you go to the About Us tab, there is a button for the parent trainings. And in there will be this slide, all previous slides, and related materials. So you'll be able to see a lot of those evidence-based approaches in more depth there as well. Common challenges and realistic expectations. We're going to go over those. And then how schools and families can work together to address these issues. So why toileting is an important life skill, right? So toileting is a functional life skill. It's linked to independence, overall quality of life, and then incontinence can limit access to school inclusion, community activities, social participation, family events, right? Like all sorts of things you can imagine, right? And so teaching toileting is appropriate in the educational setting, so not just at home, right? So toileting, having to go to the bathroom comes up anywhere we are, school, home, out in the community, right? So learning these skills are super important in getting our kids to be able to, feel like they can function and be included, in society and just their day-to-day activities.
Yeah, I mean, it's so important because it is one of those universal activities, right? That you never know when you'll need to go, and you have to be able to go anywhere. And with our students and our clients, it's important to not only teach them as early as we can, and when they're ready. Obviously, everyone's ready at different times, and we know there's a lot of challenges involved with that. But generality speaking, having them be able to go anywhere and not just limited to where they're used to, like school toilets or home toilets, right? That generalizing that skill to go anywhere, because that's really what we want to do. We want them to be independent, because this is, it's one of those natural occurring things that we all have to do, and you want to be able to do it anywhere without issue.
Yeah.
And it's going to limit their lives if they can't do the skill independently, right? So, like was mentioned, Stephen mentioned it. It affects you everywhere. So, and it could limit you access to certain things, whether it's programs or schooling or whatever it might be.
Going
So,
going to a playground for a prolonged
right,
period of time, right? Or going to some sort of event, right? A lot of these things, if you want to be able to be somewhere for 2, 3, 4 hours, they're gonna have to learn to go to the bathroom in whatever facility is there, right?
and we don't want to have adults in diapers. The ultimate goal is to avoid getting to that place, right? We have it happen, right? And I'm not talking about elderly folks who may need that extra help medically and things like that. I'm speaking more about the fact that there were the people that were never taught the skill, right? And that's something we don't want. We want to avoid. We want to move away from that happening to individuals. So whatever we can do
Exactly.
to intervene and help is a big step
It's freedom for them
in our field.
now and for the future, right?
Absolutely.
So why toileting can be hard for students with autism, right? So difficulty noticing body signals, right? Right, that like pee or poo feeling, right? Like, oh, sometimes it's misread as maybe just a tummy ache or maybe just, right? So understanding like what those body cues are, communication challenges, right? Verbal, vocal issues, right? Do they need visual aids? Do they need like what, like there may be some issue in communicating. Like they may understand the feeling, but letting you know what's happening might be where the disconnect is. Sensory sensitivities, right? So bathroom sounds, textures, smells, of course, right? So a lot of these things can be very off-putting for all of us,
Mm-hmm.
right? But especially individuals with sensory concerns. Difficulty with routines and transitions, right? Rigidity here could be an issue, right? Like Jim was saying, like you want to be able to, generalized to other bathrooms, right? So a student might get really comfortable with their one particular toilet at home, so then they're really having a hard time using the toilet at school, right? And so like having some routine or some sense of familiarity that could be generalized to both would be super helpful here. Um, and then obviously prior unsuccessful attempts can increase avoidance, right? So, not sort of letting the quote unquote failures, right? The unsuccessful attempts get us down, right? It could be very discouraging for parents and for kids, right? So being able to like work through those accidents and really talk about it and come up with a plan, right? Like look at the situation, is there a reason that accident might have occurred, right? Did they have too much liquid or whatever at a particular time, or like there'll be patterns that you can look for. And we'll talk more on that.
Absolutely. I think there's a few things here. The one thing is, of course, like almost all the behaviors we discuss in our trainings here and in our daily lives as, people who work with students who need their behavior shaped or, changed to help them become more independent. Functional communication training, right? The frustration of not knowing what to do or how to do something can be very, upsetting, right? You're frustrated because you can't let somebody know, hey, I need to use the bathroom. It has to be taught. It's not, something that comes naturally for a lot of our students. So we need to train that. That's one piece of it, right? And along with all the other, the sensory, of course, things that we talked about, but also it's being masters of our own behavior, those who are training the students, right, or our children to not overreact, right? If something doesn't go right, right? To kind of minimize that. It's not a big deal, right? We'll try again. Just like with any skill they're trying to learn, we don't want to make it that it seems like such a big failure, right? We all know failure is part of, building success, right? You're going to fail before you can successfully ride a bike. You're going to fail many times before you walk or run, right? Any skill. So the same thing with using the bathroom. And the less dramatic we react to it, I think the better it's going to be. It doesn't, it's, reassure them, right? It's okay. This is okay, right? And we'll get there, right?
Yeah.
Just like building any skill with our kids or our students.
Yeah, we're not born knowing how to do this. And like,
Right.
I mean, as most parents, I can say it's like, I don't remember being potty trained as a kid, right? So,
Neither do I.
so it's hard to like, how do I extrapolate that experience, right? So it's really just understanding, the kids as they are, right, and meeting them where they're at. So a key takeaway, right? So, lack of toilet training is not a failure, right? So many students with autism require the structured, systematic teaching, right? So as we would with any behavioral strategy or social emotional strategy, right? So just structure and having a system in place that's comfortable and lenient enough where they're not feeling bad if they're not reaching those goals right away. And then progress, like we said, may look different than typical development, right? So, we know you get your potty training guide maybe from a pediatrician and they say this is how it should be done. Again, that's very general, normative, is not tailored to the individual. So it's going to look different. And that's okay.
Absolutely. And also, with every behavioral intervention, we're taught as behavior analysts, always rule out medical first, right? Because there could be some kind of medical condition that's, an obstacle, right, to training, right? So you want to make sure you're ruling that out, making sure that they see their doctor and, to make sure that everything is okay, everything is working right and correctly so that we can be successful in toilet training. And again, there's no failure in I want to make sure I clarify we have adults that had difficulty learning along the way, right? I'm just saying as a goal try to help those individuals so that they can reach their highest independence, but there's no shame here at all. Obviously, there's many reasons why people have trouble toilet training along their journey here. Everybody's an individual. But again, good to rule out any kind of medical conditions because that could be causing issues that we don't know about.
Yeah.
None of us are doctors. We're not able to diagnose in that way. So better to talk to the experts. Make sure they're good to go for training. That there's nothing stopping them in that way.
Yeah, there's a lot of factors, right? Because like Joe was saying, it could be medical. Oftentimes social emotional, right? Like a lot of times, like, going to the bathroom is like a form of control for students, right? Like, and they may have purposeful difficulty sort of as a way of getting attention as well, right? So there could be a social emotional component underneath it as well. So working with a doctor, working with a therapist, working with trained professionals here to rule all those out is super key.
And also, there's some kids that are fearful to use bathrooms,
Hmm.
right, in other settings, so they hold
Right,
back, right?
anxiety,
That right.
there's
So
fear, anxiety. I mean, there's so
it's
many
another level.
factors,
Yeah.
and so there's a lot to unpack, right? Um, but you do it piece by piece. It can be overwhelming, but you so what readiness really means here? So traditional readiness, right? So traditional readiness skills, which would include language use around the toilet, having regular dry periods, where they're not going, and then seeing how long those last, and then formal requests. But they're not required to begin training, right? So again, establishing like a guided structure here. They'll pick up these readiness skills, maybe on their own time, or in a different way, right? If they don't have that language, maybe again, they need visual aids or, an augmented device, right? There may be other things that will um, need to be adjusted for them. Waiting for readiness can then delay progress too, right? So if you're waiting for these quote unquote natural readiness skills, right, that might delay progress. So like introducing the potty at a certain stage, just familiarity, like taking them to the toilet to see if they'll go without their requests, right? Just kind of making it a routine. I think this will come up in a later slide, but like, yeah, maybe it's, if they're home with you and you're able to maybe every 20 to 30 minutes, like, okay, let's check, let's go to the bathroom. Maybe we need to go. Right, could be one of the strategies, just having a regular check-in. That way they get used to associating those feelings with going, right? And then training can build that readiness.
And there's, what's nice about what you're describing there, it's like desensitization, right? The longer and the more often you're around something, right? Like
Mhm.
the bathroom and the toilet and the way things operate, even, just flushing the toilet, getting someone used to these sounds and the sensory that
Mhm.
goes along with the bathroom, can help, right?
Yeah.
It can make it less scary, more familiar, right? And then, maybe I'm more willing now to participate because I'm not freaked out by this room. I know what's going on here, right?
Yeah, yeah.
And it kind of feeds into that, it's exposure, right? It's like anything else, right? The more often you're exposed to something, it kind of naturally desensitizes you to it after a while. Okay, I'm used to this. I get
Yeah.
this. This is a little more comfortable than it normally would be, right?
Yeah, and there's so many materials out there that are geared for kids around going to the bathroom, right? So like, right, there's that book, Everybody Poops, right? That's a classic one.
Yeah.
My son loves Miss Rachel. Miss Rachel has a potty training book and a potty training special on YouTube
Oh, that's great.
with music and a new character that she created. I don't know if it was specifically for potty training, but it was Bean is this new character, and he's learning how to potty train, and it's really cute. And then the Bean is in the special. He's also in the book, so there's like character familiarity. So that's a kind of a tool that's new.
Yeah,
That
make it fun for the young
makes it
kids,
fun.
right? Why not? Yeah,
Yeah,
so it's not so daunting.
yeah,
That's great.
absolutely. And so, what is habit training? So, habit training focuses on teaching the toilet as a place to void, right? So that desensitization, like education around what is the bathroom, what is the toilet. Adult initiated bathroom trips, like I was saying, maybe every 20, 30 minutes, they're like, okay, let's go, let's try to go. If you don't, and if you don't go, that's okay, but maybe sit and try, right? Maybe set a timer, like, okay, let's sit for 3 minutes, 2 minutes, or however long they can tolerate. Let's try it again. I know with my son, we sat him down, like, okay, here's a little board book you could read, and just entertain yourself. If you go, you go. If not, all right, whatever. We sat on the toilet for a few minutes and read a book, like that's fine. Or a toy or a sensory object, something that's comforting for
A
them.
non-pressure situation. Nobody's pressuring you,
Yeah, like
right?
we're sitting and chilling on the potty.
Right.
That's it.
Right.
And then gradual development of bladder bowel control, right? So like if they like, because the idea is like you sit there long enough, if they could tolerate it, long enough to the point where if they had a diaper or underwear on, they might have an accident, right? And they can see the urine, or the feces go in. They're like, oh, this is what happens. This is good. Like we made a habit at home of like cheering and dancing and being silly about it. Like when my son got it right, it's like really make a big to do out of it. It may seem silly as a potty trained adult, and we don't really think of it, but like kids love praise. Kids love
Yeah.
that. So celebrate it. Make it a big deal. You have to break out streamers and stuff, but like celebrate it.
And certainly not the initial, when someone's first learning a skill, high level of reinforcement, right? The schedule of reinforcement should be pretty thick, right? And
Absolutely.
eventually, you're going to wean that down, right? You're going to thin that as time goes on while they learn to be more independent. They're not going to need that kind of cheerleading and praise.
Yeah.
Obviously, now, if anybody did that for us, we would, say, oh my goodness, what happened?
Hmm.
They might have banged their head or something, right? But for young, especially younger students, right? Like
It's
younger,
okay.
it's
Yeah.
great. Make it a big happening because it's exciting when they're learning that new skill.
Right.
And whatever works. You know your child best, reinforcement wise. And for teachers, we have at our disposal, we can do a preference assessment. So we can try and find out what's really going to motivate the
Right.
student, right? And have them, earn that great toy or that great, whatever it might be, device or,
Yeah, like a
something.
sticker chart where they earn something,
Yeah.
right? Every successful trip to the bathroom,
Leads to something
they
great.
get yeah, they get a star, they get 5 stars, they get a treat or whatever, right? If for the little ones, it could be a little more instant gratification, right?
Yeah.
Like
Immediate. Yeah.
yeah, because like as they get older, it's like okay, like now I gotta wait 5 stars, like yeah. So after they can get like a little treat, from fruit snacks or whatever whatever it is they like. And then the communication skills are going to come later, right? So using the language with them, right? Like, I have to go potty, or I feel, I have that poo feeling, I have that pee feeling. Just using that language. And it could be simple, if they can't use full sentences, it could be simplified, like you just say like toilet, potty, right? Just using that language.
Or pictures. I have
Oh yeah,
students
using
that
pictures
point
too.
to pictures of the toilet when they need to go. It's
Yeah.
great. Communication. Okay, you need to go to the bathroom? Great.
Have a picture in there, like in the home, in your house, your apartment, where whatever. Have a picture of a toilet in every room. That way, if when you're with them, they don't have to like, all right, where the heck's that picture, right? Like they know where the picture of the potty is in each room. They can like kind of get your attention and point to
Exactly. Establish that. That consistency is helpful, right? Because again, we're dealing with a timed behavior here, right? A natural occurrence.
it.
So
Hmm.
you don't want to lose time and have an unsuccessful trip because they couldn't find a picture, right?
Right.
You don't want to mishmash that up. We want them to be successful.
Yeah. Yeah.
So find ways to help them set up for success. Make
Exactly.
it easier for them to communicate that I have to go.
Yeah. So some core components of evidence-based toilet training, right? So across studies was, what's been effective as we discussed, scheduled bathroom visits, short structured sitting times, right? 2, 3 minutes, they can tolerate up to 5, just sitting and trying. Um, and obviously you want to be careful, don't make them push if they don't have to go, right? We don't need them like popping vessels,
Mm-hmm.
because that can happen too. So we don't want to force it,
No
right? We
pressure.
want it
Right.
to be natural.
Right.
Immediate reinforcement, right? Especially with the little ones and they're just learning, like that immediate reinforcement. And then data collection, like Jim was saying. I don't know if you want to add any more to the data collection.
Yeah, absolutely. You want to track, and of course you can keep this simple. It doesn't have to be this, complicated graphic system, but just kind of, using time and, first of all, how long they're sitting for, and also, dates and days, times of day. You can kind of see patterns that way, right? We use scatter plots in our field to kind of figure out what time of day, when are these things happening the most, right? But again, for this, keeping it simple, right? Having a list for yourself, making a little chart for yourself, and you can have the increments of time. Were they successful? Were they not? You can kind of just keep it like that, right?
Yeah.
And then you can kind of analyze what's going on there.
And it help you feel
And
probably
and
better about
fluids too.
success.
Yeah,
Yeah.
you want it right. You want to also add, are you giving them, a certain amount of fluids beforehand
Mhm.
and alter that as needed, right? Again, everybody's so different. So you want to make it work for your particular child or student.
Yeah. And tracking those successes is going to be good for you too, right? Because after every unsuccessful attempt, right, morale might feel low for child and parent, right? So, but if you can like see the big picture, you'll see like, oh, look at all these successes we have had. They may not be all back to back to back, right? But like, just keep an eye on the bigger picture, right? You will get there, right? It just might take a bit longer than you may have anticipated or hoped for. Again, the process may look different, but the data is going to help you find those solutions,
Mhm.
help you stay on track, help you stay motivated.
And one of the things from the literature that I've read, they recommend not looking at, let's say, your child goes, but doesn't go directly in the toilet, but in the bathroom, kind of has an accident in the bathroom, but
But they made it in
doesn't, but
there.
they made it in there. That's still considered a success.
Yeah.
And, that is just about shaping, going in the toilet, right? So looking at it from that perspective is helpful as well, because again, it's not a failure. You're in the right setting,
Yeah.
right? You're in the right place. So
Yeah.
it's just about fine tuning that behavior, which we have to do, right?
It's
For any
important.
kid, that's for any kid,
Yeah.
right? How many of us, need target practice, right? Young men, young boys, right? We need to make sure we're,
Yeah.
taught how to, get in the toilet, right?
Aim and right.
Right,
If you have a young boy, like don't stress about standing up and peeing. If it was like
right.
get him to sit first, and then they can, and then work on standing
Yeah,
up.
all the programs I've read talk about sitting and training. It's
Yeah,
not
yeah,
just,
yeah,
yeah,
yeah. I mean,
it's the easiest way
I know it's tough with
to
like
start.
with men too, though. Is like a lot of the public restrooms. Actually, they all have toilets. I don't
Mm-hmm.
think I've never seen a restroom where it's just urinals.
Yeah.
So yeah, focus on the sitting first, and then all the standing and the aiming and all that.
And that gives you privacy as well. If you're helping your child learn in a public setting
Yeah,
still, you're supportive because you can go in the stall with them. So it's,
exactly.
and that maintains, their privacy, but also you can help guide them and shape their behavior.
And thankfully, a lot of places will have gender neutral family bathrooms. So,
Yeah.
like designated, quote unquote, like single occupancy, but it's really for family, right? So, like for parent and child. And like there's, I see them in
It's more
airports.
room, which is
There's
good.
more room.
Yeah.
I see them in airports, restaurants now. I see them
A
in,
lot more changing tables and
yeah,
everything else, which is great. So
yeah,
you have a bigger space to work with, which
yeah.
can be helpful.
Not every place is going to have it, unfortunately, but it is always amazing when you do see it.
But when you go into regular stops, you can kind of, start. You can seek that out ahead of time. You
Yeah,
can do a little reconnaissance, see what kind of bathrooms you're going to maybe encounter in places you go regularly.
yeah.
A little bit of detective work,
I
right?
mean, a lot of places, like if you're going to take your child to some like a child-friendly place, they're usually going to have those kinds of bathrooms, right? If you
Like a
take,
park, right?
a
Or
park or like a children's museum or a
mm,
library or I take my son to Legoland Discovery
yeah,
Center all the time. They got that,
that's good.
like any kind of kid-oriented place is going to hopefully have something like that. But if not, right, got to plan for
You
every
make do. Yeah.
scenario. So the role of scheduling, right? So toileting is scheduled based on data, not guessing.
Mhm.
Right. So understanding like how often, what time of day, right? And so then you can kind of figure out your schedule, right? Like are they waking up wet? Okay, so maybe we got to go before bed, right? Or make sure we're not drinking too much before bed. Or is it always right after a meal time, right? Or whatever it is. You can kind of start to figure out what that schedule will look like once you're taking that data.
Right, and that goes back to what I was saying before. When you draw up your sheet, it's almost like the scatter plot style data is very helpful for that reason.
Mhm.
So noting when things are happening, right, you start seeing those patterns, and it can help you to work around that and manage that better. And again, with fluid intake and all of that, making adjustments because this is what all of us as behavior analysts and people who work in this behavior field, right, or any parent that deals with a child's behavior, you're learning as you go, right? And you're letting what's happening guide you, right? And make changes appropriately. Okay, that didn't work. Let's try something else, right?
Right.
Different strategy, different tactic. Okay. It's fine tuning. There's no right or wrong here, so you shouldn't beat yourself up if something doesn't go as planned or perfectly. We're all learning together when we train our students,
Yeah.
and it's a good process when you think of it that way.
Yep, exactly. So yeah, intervals gradually increase as success improves. And then as you when you look up the if you go on the website after this training, there should be some materials uploaded that'll help you with that plotting. I think that was included.
Yeah,
Yeah,
and if not, we have just plenty of stuff.
we can add some more.
Yeah.
I know there's definitely like a preference chart in there. A lot of literature on just like what a lot of professionals are saying. But there should be a lot of concrete things that you can kind of like pick and plug and utilize. All right, so sitting on the toilet. So we're going into like sitting times are brief, right? So we're saying like 3 to 5 minute attempts, right? If you get them there 3 to 5 minutes, that's like maybe a quick little picture book, if that's something that they're into, give them something that they can maybe fiddle with, some sensory activity while they're sitting there. Um, don't use it if they don't need it. You don't have to introduce that as like something that they're going to maybe perhaps become rigid for, and need it everywhere. See if they don't need it. See if they could tolerate sitting there through 3 to 5 minutes, and then maybe try a little longer each time. Long sitting times are avoided, or it could become an avoidance, or a trigger, I guess I should say. And then breaks may be provided if needed, right? Like, all right, if they're getting really antsy after 2 minutes, all right, let's go take a break. Come back, after say like, okay, we're gonna try again in 10 minutes. So, maybe not the 30 minute, like,
Right.
make it a quicker, make it a break, but a quicker turnaround. If they're really kind of getting antsy.
Yeah, I mean, one size does not fit all, right? Again, your child better than anybody else, so you can tailor your interventions that way, your training that way.
So reinforcement, as we were saying, so why is it important, right? So reinforcement helps students learn what behavior is expected, right? This is across the board, not even just toileting, but definitely important here. Deliver that immediately after avoiding in the toilet, right? So that immediate reinforcement, you don't want it to linger, and then reinforcement should be faded, right, as the skill strengthens, because then you don't want them to have to just like rely on that reward. So so don't start off with a lot of stuff. Just enough to keep them happy and motivated, and then slowly like trickle it out.
Yeah, you want to fade that out. Again, the goal is that the natural occurrence is going to be the reward, right? Itself. Going to the bathroom that's the final. Okay, I feel better. It's a relief, and that's really what I'm here for, right?
The goal is that hopefully they won't even need to tell you they're just gonna go, right? They're gonna go use the bathroom. Maybe then adding a new skill, washing their hands, right? So maybe their reinforcement gets taken away from the toilet use,
Yep.
and then maybe you want to then teach them to like wash their hands, wash up afterwards, right? Because toileting then also includes, right? It's not just voiding, right? Can they wipe themselves? Can they wash their hands? Redress afterwards, right? So like
the other skills,
there's a lot of skills that you can reinforce after the fact, right? And so like don't feel too bad about taking the reinforcement or the positivity away, right? There's always something new to reinforce and teach and learn. So it'll just get shifted to something else for sure.
Can listen to any better. That's right on point.
So what reinforcement may look like, right? So this could be verbal praise, preferred snacks or drinks, favorite toy or activity. And then you can do a preference assessment, and make your choice based on that.
Yeah, I mean, and it could be a lot more, right? This list is not exhaustive. It could be a song. It could be, music that you're playing. It could be so many different things.
Yeah, right? Let's go to a dance break. Right. Let's go to
It might be, but yeah, again, that's what preference assessments are for, right? For teachers, especially, like parents tend to have a good handle on what works, right? What's reinforcing to their child. But for teachers, they may have to discover it through some assessments and see what works best.
Right. Teachers aren't living with the kids.
Right.
Like, you don't see them now.
So for us, and too, there might be different things available at school that aren't available at home. So that also changes the play, right? And that communication between parents and teachers is very important as well.
Yeah.
Talk about what's working for you. Talk about what your interventions look like. Talk about what reinforcement looks like, because that can be very helpful.
Yep.
Maybe you can get that item at home too, and
Yeah,
that's not a
yeah.
bad thing, or you know,
Like if it's something small and accessible, like some kind of fidget toy or some sort of fun
or a
thing,
book
or
or
right, like you can have a copy at home and have a copy at school,
yeah,
or like whatever.
or a song or
Right. Oh
whatever.
yeah, something that can be
Easy,
replicated everywhere.
easy.
We all have computers here. We all can put on YouTube and play a
Right.
song, right? That's easy. Yeah,
Yeah.
we could do that. So why diaper use matters. So research shows so extended diaper use can increase accidents. So right, it's becoming a reliance,
Mhm.
right? Attributing to avoidance. Diapers may reduce awareness of wetness, right? Because they're absorbent. They're not going to feel being wet.
Mhm.
So you kind of have to like let them have those accidents, right? I mean, yes, it can feel uncomfortable, embarrassing, right? You're in public, right? Your child feels embarrassed, the parents feel embarrassed, right? But that's how we learn, right? So, for like again, I feel like I have a lot to say because we're just going through this with my son. We're just near at the end of it. He's getting it,
Right.
but like just have underwear days. So he's 3.5. So he's on the younger end. So there's weekends. Saturday, Sunday, no plans. We didn't go anywhere. You're in your regular underwear. That's it. And there were accidents, but eventually, you know, you would just be like, oh, okay, I don't like this feeling. I'm gonna go. I'm gonna go to the bathroom.
Right.
I'm gonna go to the toilet.
Right.
So again, we got lucky because we didn't have necessarily particular communication issues. Maybe definitely some sensory stuff, but again, every child is different. So that's just one success story per se. But again, the diaper use is going to reduce that awareness. Although I will say that if you are worried about too much mess, especially if you have like other kids or pets, they do make underwear that is more absorbent, but not diaper level absorbent. So, like my son's toddler underwear just has extra padding, but it's not so much padding that he's gonna think he's dry.
Right.
Like if he pees a lot, still gonna leak. It's just gonna help reduce some of the mess for
Mhm.
cleanup, so that way your house isn't smelling like urine all the time.
Right.
So yeah, you'll find them. I think they had them at like Target. You can get them at Kohl's, Walmart. I'm sure all the stores have it. Amazon, has everything. And then so removing diapers during training supports, their learning. Um, we learn from our mistakes. I mean, we learn from these accidents. We use language that, so again, not to keep using my son as an example, but we use language that he's familiar with. So we have one of his favorite picture books is the Tiny T-Rex series. So he has one called the First Day Oopsies. So it's not necessarily a potty training book. It's just a book about his first day of school, and he keeps making oopsies. So we use Tiny T-Rex oopsies. So we
Right.
use oopsies for accidents, and it's like
It's
a
relatable.
phrase that relates, and,
Mhm.
and, and he gets it. And it just helped us communicate. So you're going to know your child on that level and use the things that they're familiar with, and use their language, and it'll definitely help.
Yeah, I mean, diaper use, in all the literature, like you said, it can increase accidents. It could, it's one of those things that is convenient to the caregivers,
Mhm.
right? And this is not in a judgmental way. This is just, we understand. Sometimes it's just right. It's just easier to deal with, but because it's a lot of work changing a kid a bunch of times a day, or again when you're not in a convenient place to do it. But
Yeah.
we don't want it to cause deleterious effects as like rashes and things, medical issues that go with that, infections, and also it does slow down training, right? It can impede training.
Yeah.
So we want to get them out of that, right, and into awareness, communication, and the actual training, so
Yeah.
that they won't need those diapers, right? And I like the idea with the extra absorbent pants. It just helps a little bit. Any little
Yeah.
bit,
Just
any bit,
reduce some
it
mess.
helps a little, and
Yeah.
that's fine. But yeah, you don't want that's we don't want that to become the go-to, especially when they're at school being cared for by other people.
Yeah.
We don't want them to not do the work because it's inconvenient, right?
Right. Right.
We want them to understand that we're in this together, and yes, we need extra clothing, and yes, we need the supplies, but the ultimate goal is we're going to have someone who's potty trained, right, and not worry then about future issues as far as having someone dependent on diapers and not trained, right, and not
Exactly.
independent. So it benefit the hard work up front benefits you down the road.
Yeah, yeah. Just continuing, obviously, this is something that we address here at the school. So many school-based programs will remove diapers during training hours. We I think we keep diapers if it's 100% necessary, but we are working on toileting here,
Right,
right?
it's a school-wide initiative.
So students may still wear protection at other times. So again, at Hawthorne, this is something that we are working on. If your child is going to another setting, a lot of places will do things differently. So really this slide is more about like know your school, know your setting.
Mhm.
If you have questions about the initiative here at Hawthorne, please talk to Jim, Amanda, Beth,
Mhm.
because that is something that we are working on with the students here. Changes should be planned carefully and supported by all staff. There's anything else that you want to add?
Absolutely. No, that's dead on, right? It's a team effort. And again, to achieve generality and to make someone the most independent they can be, you have to really cooperate with all settings, right? With all the people involved, especially while training, right? That we're on the same page. And, we need parental help because obviously the home setting, we're not there. We can't affect that, right? And also, like Steven said, if they go to other programs, other places, maybe an after school program, who knows, any other programs they might be involved in,
Yeah,
it's important that we're all kind of working together to make the training the most successful it can. There's nothing
exactly.
worse than trying so hard to affect change, behavior change, and then, or train them on how to do something very important, like using the bathroom appropriately, and it's falling apart in other places, right?
Right.
That it's going to be hard to teach, right?
Sure, sure.
And the longer someone's in diapers, the longer they're not trained. It's a long learning history that you're fighting against. That makes it harder to train, right?
100%. Absolutely. So prompting, right, helping without doing it for them, right? So again, usually this could be visual prompts, verbal prompts, right? So prompts help students succeed initially. They are systemically faded out. And then the goal here would be independent toileting, right? So if you look at our past trainings, we've talked a lot about ABA and prompting. So if you want just further details on how to do certain prompting, you could definitely go back. But here again, it could be pictures, it could be verbal, it could be just holding their hands and guiding them to the toilet at a certain time. So it could be whatever version that they need, right?
Yeah, I mean it's behavioral skills training, right? When you break it down, it's essentially, in some form demonstrating what they need to do or describing what they need to do, having them practice, and then
Hmm.
giving them feedback on that practice, right? And
Yeah,
fine-tuning their skills until they can do it independently,
yeah,
right?
yeah,
Like a task analysis, same thing. The skills are broken down as small and as many steps as are needed for the individual. That's going to
exactly.
look different for every individual. Some
Absolutely.
need more steps, some need less, right?
Yeah,
And just like any other skill you teach, some students will pick it up faster than others. Don't be discouraged, right? We all learn at different rates. We all have different, strengths, right? That we focus on and weaknesses, right? And we have to accept those and not push beyond, the boundaries of what our students are able to do because we don't want to make this aversive at all. This is the point is to make this an experience that they don't mind participating in, right?
yeah, yeah, yeah.
So that it becomes natural.
It should be a relief to be able to
Yeah,
go on the toilet, right?
absolutely.
Right. It's like they're gonna understand, you're gonna feel that relief of not having to clean up this mess that's in order,
Mhm.
right? So the reward will be there,
Absolutely.
right? So transfer of stimulus control, right? So some programs, so use familiar cues briefly, right? So diaper here is an example, but for the other familiar cues could be, pointing to our belly or pointing to our private parts, saying that we have to go. Gradually shifting control to the toilet, result in independent toileting and self-initiated requests, right? So this is understanding that stimulus and those like the pee and poo feelings, right?
Mhm.
So the data collection we really talked about. So the school tracks, right? So this will help identify the successful schedules, adjust the timing and supports, make objective decisions, right? Is it about the number of attempts? Is it about like, right, what are
Right.
the other objectives might be?
Right, or is it, again, how much liquid and when they're given those liquids, right? Again, how much time do they need, right? I mean, the evidence-based research that I've read, usually when you sit on the toilet, when you are fully trained, it shouldn't take more than a minute or two before you start going, right?
Right.
It's kind of that's the ultimate goal
So
for the
learning to like relax your body and go.
right, and that's it. It shouldn't be a long wait process, right?
I mean,
Um,
unless your child is constipated or something, that's a whole other issue.
and but again, this goes back to really being in touch with your doctor, knowing what the side effects of any medications they're on is so important because that could be a part of it.
Right.
Of course, we know that medication can affect diet. It can affect, obviously, it could be you can constipated. It could
Or
affect
diarrhea on the other hand. Right?
it can affect in so many different ways. So it's better to rule that out, know that in advance,
Mm.
because these are barriers to potential barriers to your training, right?
Right.
Which we want to just know about, and not necessarily barriers, but just knowing, okay, this could be an adjustment we have to make, or
Yeah, like plan
you know,
around medication dosing, right? Like
right.
if you know, you
Maybe
know,
some foods can help
certain
too. Yeah.
food, right? Like, is it about fiber? Is it about, too much this or that in their diet, right? So you can always talk to a nutritionist, dietitian in that
Yeah.
regard.
It's a lot. It's like we talked about. It's a lot to unpack.
Yeah.
When anyone's on medication, there's a lot of factors to think about.
Yeah.
That long list of in the commercials that we always hear,
Mhm.
right? Of
Right.
of the FDA things that they've tracked that could be potential side effects.
Mhm.
Sometimes it's exhaustive, and these things could affect our
Yeah.
students
I
or
mean, we do it for
individuals.
ourselves, and I know it's
Yeah.
added, but we got to do it for our kids too, right? And
And I noticed it. I don't know if you have. When I take certain medications, they just ruin my stomach,
Mhm.
and it's a very
Oh,
unpleasant
yeah.
experience.
Or I know if I have a certain kind of food that doesn't like, agree with me, right? Like,
Mhm.
so knowing your kids,
Food
food
intolerance. Yeah.
tolerance, right? Like, or lactose intolerant, right? That could be an issue. Any other sensitivities that exist. There's a lot. There's a
Goes
lot out
back to that medical. Yeah,
there.
exactly. That's why it's a key component here is
Yeah.
including your doctor in these discussions when you're going to
Absolutely.
begin training.
So what progress really looks like, right? So, in summary there, so increased successful voids, longer dry periods, reduced accidents, and then gradual independence, right? These are sort of the key pillars that we're kind of working for. You're not going to get here right away, right? So the dry periods might start small and they may just gradually increase, right? It's going to take some time, right? But, as you see that number increase, right? You'll start to see you're heading in the right direction. Right? Any of these things start to decrease, that's sort of like a little red flag for you of like, okay, maybe something's up. Do I got to talk to the
Mhm.
doctor? Do I got to what's changed here?
Right.
But all these numbers should be increasing for you. So common parent concerns, right? What if it doesn't work, right? So again, so just knowing that many students need weeks, months. It's not going to be days.
Mhm.
A lot of kids like even the weekend boot camp didn't really work for my son, right? Doing the weekend kind of just like in his underwear, like we still had accidents. We still, things still needed to be finessed and communicated better,
Mhm.
right? So it's really going to take that consistency day in day out until they get it. But once they get it, right? And then you're free from the tree, well, presumably you're free. Obviously things happen, but it's that intensity won't have, be as much.
It's not. It takes patience and kindness, right? Not
Yeah.
only to your child, to your student, but to yourself, right?
Mhm.
It's important that you remain patient and calm, right? Because again, Stephen is exactly right. These things don't happen overnight, and everyone learns at a different pace. And there are certain barriers we may not be aware of,
Mhm.
right? Some kind of experience that they've had that they can't communicate to us that makes them a little afraid to go, or who knows? I mean, a loud noise they heard in the bathroom once, and
Right. It could be completely unrelated to
a pipe
actually
noise or
going,
something.
right?
Yeah,
Yeah.
right. So we have to keep in mind that, right? And again, set it up so that it's not a daunting thing. It's not a scary place to be,
Right.
right? That it's a welcoming, calm place. That it's set up so it makes it like they want to be there. Have those reinforcers ready. right? And be calm, and your voice, is measured, right? That you're not getting, you know, um, anxious about this process, because that's one thing you have to be a master of, is your own behavior. If you want to change someone else's, you really have to be aware of the way you approach people, the way you talk, right?
Right, right.
And expectations have to be realistic. I think that's also uh, needs to be said, right? We
Yeah,
have to have realistic expectations for our students, our clients, our
yeah,
children, because everyone's in a different place, and
absolutely. And it's only fair for
we have to
you
meet
and the
them there.
kids. Yeah,
Right? We can't force them to come where we are. We have to meet them where they are.
yeah, yeah.
So
And then lead us where they gotta go.
yeah,
So toileting accidents will happen after success.
absolutely.
You know, it happen. They're sick, right? They have the flu, maybe, or maybe they don't have great control, right? Because it's like they've worked so hard to get that control. Then you throw in like some sickness like the flu, and
Sure.
it's gonna mess them up, and that's okay.
The
Um,
medication changes, like we
right,
mentioned
right.
before, that could cause a problem, right? Fear, right?
Mhm.
I've had students that are afraid of certain sounds, and that might cause them to wet
Yeah,
themselves, right? And grown adults without any disability, if they are robbed at gunpoint, they might have an accident. It happens. It's very common.
there's an
Fear,
emotional component
yeah,
to our
our body's reacting in that way.
Yep,
There's no shame in that, right? It's a natural function that could
yep,
happen under duress, under that kind
yep,
of stress. That's extreme stress. I'm throwing a very extreme example out there, but again, or illness, right? You know, or deep sleepers. We didn't
yep,
talk about that. Accidents in bed at nighttime. You might be a deep sleeper. That could be medication cause, or it
yeah.
could just be your natural tendency. It's harder for you to get up, even if you don't, even if you realize you need to go to the bathroom, but you may not be able to get up in time.
Yeah, yeah.
There's a lot of factors here. So,
It was a very classic, like incontinence in children can often be a trauma response too.
right.
If you know that there's any trauma in your child's history, right? Like there's a lot there. So again, that's all like outside of the norm, but still something like if you know exists, is important to talk to like your child's doctor or therapist or counselor about that. So nighttime toileting, so nighttime continence often develops later, right? So work on the daytime routine. It's okay, to put a little, if if the diaper goes on at night, you know, that can come out last, right? So, focus on the daytime, and then graduate to nighttime success. And then, so separate plans may be needed for both.
Yeah, and there's different. I know there's different pads and mattress covers that
And then like rubber
yeah
coverings that
that
go under the
that can
sheets.
help while the student's learning, while the child's learning. And yeah, it really should be separate and treated as such, because again, there's different things happening when you're passed out asleep, right?
Yeah,
If your child didn't sleep well the night before, they might be in a deeper sleep the next night, right?
yeah,
And that can cause an accident to happen because
yeah.
they're not readily going to jump up and realize. So yeah, these things take time.
And
You
keeping an
know,
eye on fluid intake
that's the
too
other
close
thing,
to
right?
bedtime,
Yeah,
right? Like,
that's a classic one.
yeah, yeah. Well, I know a lot of times kids, like, especially if they're coming off of the bottle when they're little, right? They're so used to milk before bed, but obviously babies, they go in the diaper, so it doesn't really matter, right?
Right.
But then kids get so used to using like beverages as a comfort thing to get sleepy,
Right.
and then that becomes a problem,
Right.
right? Even though they're not, in diapers anymore, or they're not a baby anymore, but that comfort thing. So like, yeah, like limiting liquid intake, whatever their bedtime is, like cut it off like maybe 2 hours before. But that's something you can
Right.
talk to your doctor about. I can't necessarily say, but you think whatever is appropriate to their bedtime, right?
Hey, for us adults as well. I mean, there's nothing worse than having to get up in the middle of the night because,
I gotta
I
go.
had too many beverages late beforehand. And then it's like, oh, I should have had that coffee, that
Right,
tea,
right.
or, you know. So even we learn the hard way
Yeah.
sometimes.
Or smaller portions, right? If they're used to having
Right.
a bigger cup of something, they're like, okay,
Cut it.
this is helpful.
Yeah.
Do half,
Yeah.
do like 4 ounces instead of 8 ounces, do three, whatever.
That's a good suggestion. Yeah. Little
Um,
things like that.
so I mean, we kind of talked about the home school collaboration already. So parents and school staff communicating, like sharing the data, sharing the routine, the successes, things that have been helping. That way, we can mirror that experience, right? And expectations are shared and should be realistic.
Yeah, I mean, transparency is so important, right? Because nobody wins if you're bulking up the levels of success when they're not there, right?
Right.
As much as we want to be positive as educators and caretakers, right? We have to be realistic. We want them to have real outcomes, not pie in the sky outcomes. And we don't, we can't say something's happening if it's not, right?
Exactly,
And that's
exactly.
okay, but there's a positive way to communicate that with each other, right? That's not a negative, or if they're not being successful in something yet, that's okay, right? They'll get there, right? And we need to encourage each other as well, because we're in this together. I
Mhm.
mean, that is the best way for success long term,
Right,
is
right.
that open communication, sharing ideas, sharing what's happening, because all those things have a factor. Setting events is so huge, right? If I know, you tell me as a parent that Johnny didn't sleep well last night, that helps me. That's
Mhm.
helpful information. Or was not feeling well and
Yeah.
sick and up half the night because his stomach bothered him. Okay, that's going to be very helpful going
Now we
forward.
know why,
Yeah.
he's feeling
Or
that
got on
way.
the bus and had an issue that sometimes the bus companies don't report to us, right?
Right, that's a whole other separate entity,
Yeah.
right?
So that help knowing these things is very important. So that communication needs to stay open.
Absolutely. Just additional things that parents can do, right? So ask how toileting data is collected. So again, mirror maybe how the school does it, and then you can do it at home. That way, it reflects and it just looks the same and is sort of easily comparable. Sharing relevant information from home, exactly what Jim was saying. Maintain that consistency when possible, and then yeah, going back to celebrating the small steps. All right, so our kind of our key takeaways, just from this, there's a lot to talk about here, but just for
Yeah.
us, in summary, so toileting is teachable. The readiness is not required, right? There's no prerequisite to just start. It's going to be messy, and that's okay. The evidence-based programs work. So looking at a lot of, so I'm going to have a list of those resources. They're all going to be posted. If you reach out to us, we can get some resources. If you need, email it to you, and all it's, it's all here. It's available for you. Nothing is being locked away.
Right.
And then again, progress takes time and support. These are some of the authors and researchers and professionals that have written on the matter. Again, so all their articles and data will be on our website along with these slides. So that way you can, see it. And, again, if you have questions, please feel free to follow up with us.
Yeah, I think just in summing up, it's again team effort, and it's something that can be done. I mean, earlier the better is definitely is not a bad thing to say, but it's never too late, right? And that's important to keep in mind as well. So don't get discouraged. Hang in there. It's a big skill to achieve, but once achieved, it opens up a lifetime of independent living, right? It's a beautiful aspect. It's really an important piece of the puzzle for our individuals, right? Being able to do that, opens up a lot. So it's worth, putting all the effort in, and we're here to help and support. So thank you
Absolutely.
for listening in today.
Yeah,
I
and
appreciate
if
it.
you have any more questions, he said, please reach out. Jim and I, here's our number or email. And you can call, email, let us know if you have any other questions about the presentation. If you need more resources, we're always here. All right, thank you, and we will see you for our next session in March.
Take care.
Take care.